Good evening. Oh, and welcome to another season 2 of Positively Positive. Oh, season 1 was incredible. Great guests, great information, accurate information, people all over the country. But this year, we're going to spice it up a little bit, as you can tell. Our guest tonight is absolutely an incredible woman who you're going to know in a very few minutes. What Positively Positive is all about, this show is dedicated totally, completely, with nothing else. But somehow, anybody, everybody, something, everybody is related to HIV or AIDS. There is no show like it. The media is not touching AIDS anymore. It's manageable. It's all under control. The pharmaceutical companies are having a great time. But HIV is still here. And a show like this that tells stories, that tells you where you can go in your area to get tested, where it has resources, where it enables you to get accurate information. We have organizations, we have health departments, we have churches, we have pastoral counseling, we have people from all over, and it will be some returning guests. We will have new guests, as tonight's woman is, and we will have a lot more resources and facilities. We want that. We want you to know where you can go in your area, or at least check with your county health department to make sure you're up to date on everything. There is so much information out there that Positively Positive, I think I forgot to introduce myself. I'm Susan Lee Mintz, your hostess. But I forgot about that. I was so excited to see myself all dressed up. We're spicing this season up. But we always want you to know that at Campbell Health Solutions, Richardo Jackson, and myself, we will never stop telling stories and focusing on the importance of HIV testing and making sure in a world that has so much disinformation, we want you to be able to go to safe places that have the best for you because we care. Kindness is what we care about. Your health and kindness. So, my guest tonight is Sandra White, who comes through me, through a great friend, through another great friend, and through an incredible retreat where I met her. HIV retreat, HIV Care Council retreat. She is truly a woman of God. She is a community activist and organizer. She has a background in criminal justice and administration. She and her husband have the United Deliverance Church of God in Christ in West Palm Beach. She has been a mentor, a community leader, a member of the Palm Beach County Health Department. If I read her bio, which I had to read 4 times, if you read her bio, it wouldn't do her justice just to read it. I want her to tell you why she's involved and what she is doing. So as many, many, many of you know, when Moi removes her glasses, not as much makeup this year either. It's time to say, Sandra White, come on in.
Hello.
Hi. That was quicker than usual. We usually only said the introduction. I misunderstood. Usually there's kind of a countdown where it's 30, 29, a second countdown and everything. And that's what I was waiting for. So I was caught off guard because I didn't understand that. And then there's usually a little countdown when you would come on. So we're not doing that anymore. We're going right into the show. So welcome, my friend, Sandra White. Hi.
Hello. Thank you. Thank you for letting me be on.
Oh, it's marvelous. This is what the show's about. What I always like to say is, as I said, I've read your amazing bio, and truly, truly, you are a woman blessed, and by the grace of God, you're still going by the grace of God. He has blessed you in so many ways. And just what I want you to do, though, how I like to start is I almost remove the bio that I've read because I really like someone to tell me their story and why I'm where my boa, believe it or not, is shedding feathers all over the place. I'm shedding as we speak. The reason, though, I want you to do is I like to start is where were you born? I'd like you to take me on Sandra White's journey because it's so much more interesting. You know, you go to places sometimes and they read a bio on somebody, but the time they finish the bio, the person's ready to go to the bathroom or go to sleep. I like to let the person speak about what they're doing. So I want you to tell me, Sandra White, where you were born and how you got to your education and take me on the little journey to where you are right now. And sometimes I will just kind of, put a hand up as if to say stop. I forgot. I usually have a fan. I do, but I'll just kind of put my hand on. If not, we might have an overlap when we speak. But tell me where you were born and how you got involved in education. What's your background?
I was born in Salisbury, Maryland, and when I got out of high school, I moved to Chicago, Illinois. Um, Stayed there for a little while and moved to Florida to be with my mom. And that's where I met my husband. We started. I was going to church and met my husband. We got married. He wanted to start a ministry. Both of us were close to God. I'll put it like that. And we started the ministry, and just things happened. We started working in the community, doing a lot of things. We helped people to uh, get houses. We paid rents. We did a lot of people, and we along the way we met people that had HIV/AIDS, and that was before it actually was uh, put
An
in.
epidemic.
Yeah, and we used to visit. I remember the one young lady. We used to visit her home and pray for her, and but her family had her stuck back in a closet and in a back in the back room because she had HIV/AIDS or HIV, which did progress to AIDS. And
Sandra, Sandra,
yes,
you met your husband in church.
yes, I met my husband in church and we married.
And
And that's when we started the ministry. Right after we married, as a matter of fact.
you
And
found the need, you found the need in the community for the homeless and the marginalized community. You saw the need for spiritual wellness and other in that area in the homeless community or the marginalized, as they're saying.
yeah, the community we were in, there was just so much homelessness and drugs and crime, and we just decided that we needed to start helping, and we did. We did a great work. We did a big work. I'll never forget the vision that I had. This was even the vision was even before I got married because I remember praying and asking the Lord what my purpose was here on earth, and didn't get an answer right then. But the way that the Lord just brought us into working with HIV/AIDS, we knew that it had to be of God. It was something that we had to do, and we got moving.
And so
We
you didn't personally have it in your family or experience it. You just were put into this need to have more done
yes,
to help. And tell me about
right.
the woman that you said that when you went to the home, they had her in the back room.
Yes, they had her in the back room, and they actually wouldn't even let me go back to see her. They would only let the pastor go, so he would go and pray with her. Eventually, she passed, and not too long after that was when we started hearing about what was going on in the community in the communities in Palm Beach County.
Mm-hmm.
Um, we went to a town hall meeting in Miami at the Knight Center. I'll never forget. My husband had a chance to be on the panel, and we heard that the HIV in Palm Beach County was in epidemic proportion,
Mm-hmm.
and we couldn't, we just couldn't sit back and accept that. But the thing of it was, it was not many people working or trying to help people with HIV in our communities. I'll say even pastors, black leaders, in Palm Beach County. They weren't working with it. They weren't finding I'll call it the niche that was needed to really get out there and help the people that needed the help.
About what
So
year? What year was this that you were beginning to feel this? When was this?
this was in 1999.
Oh, okay.
1999, yes. It was in 1999.
Right.
We,
Uh, That's a long time because I was involved since 81 when we heard about it. And then in
right.
92 when my husband was diagnosed and in 94 when he passed. But 99 already, you're into some of the better medications though.
Well, it was not in the black community.
No, there's the
The
need.
black community was not being notified about what was going on back
No.
then. We just decided that we were going to do something about it. Um,
Mhm.
one thing that we did in 1999, um, we got a grant from CDC to do testing and counseling, and at that time, it was CAP, which is now Found Care,
Yeah.
Glades Health Initiative, and United Delivers. We got together. They gave us a grant for testing and counseling, and we were we eventually came up with, how are we going to reach these people? I mean, in the black community, there was I'll never forget it, there was a big billboard at the end of Tamron Avenue, but you never saw anything on it about how the black people were being devastated by HIV/AIDS.
Hmm.
So we decided we were going to get out in the streets. We were going to go in the streets and try to reach the people. We started out with tents. We started with tents. We were
Yeah.
in camouflage uniforms, and we started frying chicken because we knew that everybody wanted to eat and they would love to have fried chicken.
Yeah,
Okay,
food.
so that's how we got to started testing and counseling. And I know that the health department was really involved. All of us worked together, and they saw the work that we were doing, and they felt like it was a great work. So, they gave us funding and helped us do the things that we
Get on
needed
your
to do, and that was great to get
what
on our feet.
with your background, it says also in criminal justice and administration. I mean, you've got so
Mhm.
much in there. Tell me where you went to school and your degrees you got in what?
No school.
All
I've
right.
been taking college courses,
And
I think a lot of my training I got when I lived in Chicago. I worked for Community Court Services there, and they had a prevention case management there. And but it was, it was involving criminal justice,
okay,
and I took that training, and that's how we started our prevention case management with HIV/AIDS.
from your
Um,
background.
yes, from my background.
So
Uh,
you'd say that most of your experience has been
yes,
hands-on, and
yes,
it's not been
yes.
formal. It's
Mhm.
been there's a need
It was
to help.
informal.
Where
Yes,
can we fill that need? That's what this show's about.
yes.
There's no show
Mhm.
like it because there's a need to share this information, your story. This is what this
Mhm.
show was all about. It's birthed out of. There's a need for this, a worldwide, community-wise. Now, with Palm Beach County, did you meet your husband? I'm fascinated you met him in church. Did you meet him in church here in Palm Beach County?
Yes.
Oh,
Yes, I did. Yes, I did.
and
Um,
what
it
does he
was
do now? Is he working with you? You're a team together doing this at United
Yes,
Deliverance?
we were a team doing this. Yes, he was a go-getter. They called him the radical preacher,
Well,
because he would get out there and he would, whatever he had to do, he would do it. He helped so many people, but with the help of God,
of
because we
course.
put God first in everything that we did. It was nobody but God that led us to be established like we were, because all of a sudden it seemed after we got that first grant from CDC, it seemed like people were coming out of the woodworks to help
Mhm.
us.
Yeah.
I'll never forget where I can't even remember how we got our grant writer who wrote the grants for us and didn't charge us a dime. That was nobody but God, yes.
Only God.
Um, we
You
had a Reverend Morris. I'll never forget. Reverend Morris always got us the supplies, everything that we needed to go out into the community. Literature. We got condoms from the health department, and literature from the health department. Uh, Everything. I tell you, it was so amazing how God works in your life if you let Him. If
Mhm.
you love Him, you got to be, let Him do what He wants to do. He wanted to.
You men-
God wanted to.
you mentioned
Well,
something about you mentioned something about condoms, and I want to ask you because I'm in a church where pastor doesn't, believe in that. He believes in abstinence until you're married and you keep it straight. And there are churches that give out condoms. Did you give them out in the street, but you don't give them out in your church?
we gave them to whoever wanted a condom,
Okay. So
because
you
if that was their way of wanting to be, protected, then you just, if that was their way of choosing to be protected, then uh, give them a condom, I say. But
so
we
you
believe in abstinence also. That's the thing. We're going to encourage the abstinence part. Yes.
That's what I was wondering because it sounds wonderful to speak about abstinence and don't have it, don't cheat on your spouse. In reality, it doesn't always work.
That's
And
right.
my issue is, yes, I would love to promote abstinence, which I do because it saved my life. But any way that keeps to me a person safe, safe is what I care
Yes.
about. Get
Yes.
tested and get tested. Know your status. Get to the right medications, the right doctors. Are you in that
Yes.
position now? You're affiliated with the health department also. What is your position with the health department?
Right now, I'm a record specialist. Um, yeah, I'm a record specialist now. But what we did back, that was so many years ago. But it made an impact on the community. What we did do, because we were not afraid to go into the
Mm-hmm.
streets. And it was dangerous in the streets. It was dangerous, and you only went out at night. You don't. It was you weren't going to reach anybody during the
No,
day.
no. You know
So we went out at night.
The movie The Dark Knight, that just hit me right now. Just think, you went. The Dark Knight is sitting right here, right? In the studio right now. The Dark Knight. It's true. It's dangerous.
Mhm.
How do you feel? Bringing it up to date though. I'm still a believer that the African American and the marginalized community is still so impacted in every area of health that they are still never getting the right information, the resources, not just the education, the finances. To me, the progress that's still been made in the African American community, has there been some? Yes. But
Mhm.
is there so much more work to do and to
There's so much more work.
know
Uh,
where?
we just
I don't
we
know how
just
to get across to people more than if the media would finally start picking up on this.
again,
Like that's right, like they used to when it first really
like they
started.
used to,
Like
yes.
COVID, the fear factor kicked in, and so they were sharing all this information. If what is it going to take, Sandra, for the media, the mainstream media, not the Google stuff, the
Right.
mainstream media to start talking about HIV and AIDS and tell people that yes, the African American community is still heavily impacted. Not just men
Yes.
having sex with men, but African American women. So many of my guests from last year who will be on again this year, they were affected. In fact, I mean, it blows my mind that today we're having to still talk about our community being so lack of visibility and assistance. Tell me about it.
Yes. Well, the statistics just came out. Was we went to a meeting last week. Um, there's is the black community is still under is still high in HIV AIDS.
Yep.
Still high,
And women,
and
and
we're the ones that are most affected with it.
the women,
The
and
women and men and men.
why why do you think though it's so much again with the African American community, and we're not just talking Palm Beach County, which is the third highest in the state and the fifth
Mhm.
highest in the country for the incidence of HIV and STDs. I mean, STDs are on
Yes,
the rise with seniors. So an STD is an STD, whether you want to call it syphilis or you want to call it HIV. No one's talking about this. But tell me though what you feel is that in your church, where specifically, name your church and where specifically is it located? Give me the address also.
well, we didn't have our church anymore. That was back in 2013
All right.
when we did. Yes, we don't have our church anymore, but I want to talk about what we did because it really did impact the community. But the main thing is that there's still a lot of stigma out there. There's still a lot of people who do not want to, you know, acknowledge that they have HIV, so they're still spreading it. A lot of people don't, you know, think about getting tested like they really should. I'm talking about today. They didn't think about it back then when we were doing the testing, but today it should not be. The stigma should not be as heavy as it is. People should
It's
want to talk about HIV. They should want
yeah,
to talk about it. Hmm.
they should. And it's frustrating for people like you and myself and people with the health department that we're up against this brick wall yet.
Hmm.
They talk about the glass ceiling. And by the way, I dressed up specifically for you. I mean, I am really
I love it. I
Season
love it.
two is definitely glam. I mean, we're glam in season two because we're taking serious subject matter. I mean, I just know though that I don't understand what and who. It will take one person that God is going to bring forth that's going to shed a whole new light on this again. And people are going to say, Larry,
Again.
what
And
the complete
Susan, I believe you just said a word. I believe that even when we did it back in 1999 for those 13 years, that he used United Deliverance Community Resource Center. At that time, we made a real big impact. I mean,
Mhm.
a big impact. The numbers were not. I mean, in the thousands. So it's not about numbers to me. It's about helping people. Making them aware of what's going on. But we did reach a lot of people. We reached a lot of people.
And so, do you and your husband still go out into the streets and do your
No,
ministries?
my husband passed. He passed some years ago. Um,
Oh,
so I work with HIV still, but um, plus I'm an older lady now. I don't do. I don't. It doesn't matter. Me working with HIV. I love that. I want to help people. That's been my life. You
that's yeah,
know.
yeah. I picked that up from your bio about that
Yeah.
because my husband passed 30 years ago from
Mhm.
AIDS, and I just knew it was the ministry God gave me, and I didn't even question it. I knew that no matter where it went, I was supposed to speak about it, and I do. And it bothers me. It hurts me so much as a woman. Of not I'm a Caucasian, I'm white, and I have resources, and to a point, and I'm able to go like to the care council meetings or the retreats.
Mhm.
That's where my eyes got opened up more to see that
Mhm.
at HI Care Council, we have so many great resources in Palm Beach County, but a lot of people don't know about them. So
Yes.
how do we continue to reach people who seem to not be reachable?
Got to talk about it. Spread the word. But the word is still is it's like it was cut off. It's not being spread like we tried to spread it back then. Um, I know Caroline Hill is still working with it, and she was
Yeah,
my program director. Yes, when
she's
we
the
had
one I
the.
met. She's the one I met right after Jeff died. And in fact, we're going to have a guest on who from CAP, who remembered me from the retreat from 30 years ago with CAP.
Mhm,
And he came
mhm.
over at the retreat and said, "Are you Susan Min?" I said, "Yes." So he's going to be a guest. In fact, I'm going to send him the link to be on the show. But I think that's amazing.
Wonderful.
You're all connected in one way or another. Like
Yes.
you mentioned
Yes.
Rob Scott. So how long have you been in
Yes.
the health department, the Palm Beach County Health Department? You're full time, right?
I'm full time. I've only been there a short time. Um, I just got back working with HIV AIDS, so
And
as a
what is
record specialist.
and did you say a record or what is it?
Record specialist.
A
ADAP
record.
is working with
Oh,
ADAP,
that's
giving
right.
them, yes, their meds, giving their meds, making sure people get their medications.
Oh, explain that further, what ADAP is and what it means.
It's the AIDS Drug Assistant Program. The AIDS Drug Assistant Program, where we help to help pay people medications.
And how do they find out about this, that there's fun? How do they deal through the health department? How do people find out about ADAP?
Oh, through the health department, they have to be eligible for ADAP, and ADAP. I mean, the health department uh, sees if they're eligible for ADAP and having their meds paid for. Yes.
And what is the criterion then? Because I've not talked about this very much. We had someone last year, last season, who was with them, but we didn't get a chance to talk about the criteria of it. What is that?
Have HIV, you have to be tested and have HIV. It's
All
not
right.
like not like it used to be. It used to be where you had to have all these documents before you could get your meds. If you were um, uh, homeless, and if you didn't have your driver's license or identity or anything, you couldn't get your meds. This was years ago, but now they have it where, and they've uh, put it into the program where you can get your medications without having all that information.
And they would get tested through the health department.
Yeah, they can get tested through the health department. Yes.
Is there an income? What I'm saying though, is there a certain amount of money if they're, let's say, what about if they have insurance or if they can afford their meds? How does it work then for a person to get assistance?
You just have to be under the federal poverty lines, which is 400%.
Explain that to me because I don't understand that part.
Yeah, if you make a certain amount of money and go over the federal poverty line, then you're able to basically pay for it yourself. But
And
if
and
you're
what is
under
that?
that,
What is that baseline though? What is that poverty level? What can
under
you?
400%
But 400% of what?
of the money you make,
Under
that's the
400.
poverty.
That's considered under.
400%
So if I'm making ten
of the,
thousand dollars, let's say I'm making ten
they
thousand dollars.
they'll calculate that, and if it's under 400%, then you can basically get your medications.
So it's much easier than it used to be. You don't have to jump through hoops. And
Yes, it is. Yes, it's much easier.
are the
Yes.
majority of people that you're meeting applying for this assistance?
Oh, yes, they are. Yes, they are.
Is that because they're not working or they don't have insurance? Is that why would that be?
Um, because they need help. You know, medications are so expensive now. Um, but you know that, for the pharmaceutical drug companies are trying to make as much money as they can. So at least ADAP is helping, the individuals to get their medications, regardless of what the amount is. They pay for it. Yes.
And that's why I think complacency has set in. Let's say for the youth, let's say under 20, 25 years of age, or for seniors over 55. I think because no one's talking about it, complacency, and they put the commercials on TV where everything is fine. You can take this pill, or you can have a
Right.
shot, or you can. They've made it all seem like it's okay. It's not any big deal. And in some ways, for many, many people, it isn't anymore because it is. The drugs are amazing, but the pharmaceutical companies aren't helping you out one bit, right?
No,
You're
they're
saying
not.
you're fighting for every dollar in the health department, aren't you?
I try to do what I can.
And
Yes.
have you seen the money dry up every year for funding, or is there still money that is available for funding?
I can't talk about that because now I used to know that information, but since I've just got back into the health department, I'm not really familiar with, the how the money's coming in. I'm not familiar with that at all.
But the need, would you say though, the need in Palm Beach County is definitely great for help, for education, for every aspect of this.
I would definitely say so. And I believe that there needs to be more money coming in because it's still, you know, one of the highest population. It's a lot of cities, that are highly populated with HIV,
Mm.
AIDS, but in the country, now, but we still need help. We still need
Oh,
as much help as we can get.
then you said densely populated, and it's so many multicultural type of, in the beginning, in the
Yes.
80s when we were in Houston, and in the early 90s, Boca Raton was very different. Even now, I think people think Boca has no poverty. It has no, I think all they see is the glamour of it. And I always say where I hang out, Belgrade is his issues. Palm Beach County is as diversified as the state of Florida.
Yes, it is. Yes, it is.
I mean, look at
Um,
Belgrade. They need a lot of assistance in Belgrade. They're almost shut off from everything.
right. We used to. My husband was so radical. I use that name. That we had a bus going out to the different communities. We didn't stay in the tents. He eventually fixed up a bus. I have to talk about the bus. He took the seats out and made little booths in it. And when we went out to Belglade and um, we went some parts in Jupiter, some parts near Boca, Boynton, Delray, you name it. Um, we would do the testing and counseling in the bus, and we
This is
pull out the chicken.
and
we
always
pull,
the fryer went with you, didn't it?
yes, it went with us.
The bus, the chicken, the fryer. That's a wonder. See, that's the story right there.
Yeah,
You felt so involved, so impacted by this voluntarily. You fell into this. And then you
yes,
get a bus and he pulls out the seats in a
yeah.
bus.
Hmm.
Tell me that again. This is so cool. Tell me.
Yeah. He put out all the seats, and he built little booths in there so that we could. And man had curtains up.
Like the Red Cross blood mobile, where they had
Almost,
booths.
I haven't been in the blood mobile yet.
Yes.
The people thought it was the blood mobile when it came, because
Uh,
it was red and white. Yes.
that's what I was picturing. It looked like the bloodmobile was coming. And the chicken, and you didn't charge for the chicken, that's for sure.
Oh no! And I tell you, anytime you get something free, they're right there.
They remember
They're
it too.
right there. Hmm.
They remember
Yeah.
your kindness.
Oh yes.
Yeah.
I mean, we got to the point where whenever we rode into a community and they saw the bus, they would come out and get tested. Some people were actually hungry though.
Yes.
Some people were actually hungry. They would come because they knew they would get some chicken also. But
Oh,
we would also give out food vouchers, gift cards, um, that kind of drew people into getting tested also. Hand out the literature.
and you
Yes.
and the thing is, you didn't have to do this. This was something God put on your shoulders and in your heart to do. And when you met your
Yeah.
husband in church, he had the same feeling.
Yes. Isn't that
What?
something?
How
But
powerful was? How powerful a team? Do you have any children?
no, I don't.
Me either. Boy,
No,
are
I
we
don't.
close. Widows with no kids. Hallelujah. We're okay, sis. I told you, with all our emails and all our texts and we were going to get to know each other very, very well.
Yes.
Um, I just want to also make sure, though, if people want to contact you or through what is your contact information through the health
Uh,
department?
Well, not through the health department yet. I'm working in
Okay.
ADAP, and that's my job. I just help with the ADAP, AIDS Drug Assistance Program. But if they wanted to contact me any other way, they could either give me a phone call or email me.
So what would your email address be? Because people are going to be watching this.
My email address is W Sandra Sandra 788 at gmail.com.
Charter will put that up at the end. We'll put your information up that people can contact you because we like we keep the show very personal. Some people it's
Mhm.
more one way, the other way. This tonight to tell a story about a woman who I met through Rob, through I met somebody, met at the retreat. I went right over to you too, and I said, "Would you like to be on the show?" And you didn't hesitate. You were wonderful,
Yes.
and it was so great.
Yes.
But I think about when you look back at your life and the journey with this, do you think that any part of it was really you, or was all of it the hand of God on you, telling you what to do?
I have to say it was nobody but God. I used to tell my staff all the time because they would, wonder how I would get through certain things. And I'd let them know it's not me, it's God. God is doing this. He's giving me the knowledge to do, to put this whole thing. I'm talking about the administrative part. You know, he gave me the knowledge to do it, and it was successful.
Do you still do any counseling on the side or ministry work on the side?
Oh yes, I do. I attend another church now. Uh, we we I'm an evangelist. Yes,
As you said, 30 years as a licensed or certified
yes.
or registered event. Tell me about that.
As a licensed evangelist, I love to talk to people about the Lord, number one, but any way that I can encourage or help or uh, refer, uh, whatever I can do, that's what I do. But it's mainly talking to a person about the Lord, to help people get their lives straight, so they can live better.
So you find that part still very rewarding.
Oh, yes, yes.
So you're not a numbers cruncher. I pick up from you that it's not about numbers, it's about
No,
people.
it's about people, yes, for me.
Yeah, always has been, hasn't it?
Yes, it has.
And where do you live? I don't want your address, but where do you live?
I live on 45th Street, West Palm Beach.
Near the health department.
Yes, near the health department.
Oh, you're
Is
a
that
war.
God? Is that God?
Oh, that's
No,
wonderful.
that's God, yes.
Oh, yeah,
Mhm.
that's so wonderful. I'll be getting your address privately from you there if you don't mind.
Okay,
Just between you and
okay.
me. Just between you
Hmm.
and me. Anyway, so the retreat though, wasn't that a wonderful retreat?
It was wonderful. It was wonderful. I even saw people that when you know people have HIV AIDS, you do not disclose them, of course. And for me, working with people way back like that, I still see people that we worked with back then, and it's so, and they know me. They know
And,
me. This night, they come up to me. Hmm.
and don't you think though that when you get involved with something like this, that you don't stop, no matter where it takes you, whether it's like breast cancer awareness or any other kind of a rape crisis or mothers against drug drive. When you get involved with something that I think personally touches you, I don't think you ever quit. You never give it up. You
No.
make different directions. I never thought I'd be in Boca, living in my dining room in a boa and
Hmm.
glasses, talking to people, on a podcast. But here we are. And I think that that's just so powerful that it is all God's work, I think. And
Yes, it
somebody
is.
said to me, though, also, Sandra, and see if you agree with this, that you don't choose your message chooses you. Now, do you
Yes.
want to accept your message? I think a tremendous amount of people don't want to accept the message because it can be very hard.
Yes. Can be very hard, and they have a choice to make, and some people don't like to make choices.
No. And as far as the stigma goes, you still feel like we've made progress, but the stigma, talk to me about that from your perspective over the years, what you hear, what you feel.
As far as stigma, people still don't want other people to know that they have HIV/AIDS. They don't want people to know. So they're going to try to hide uh, what they're doing. Whether it's being promiscuous or the things that have happened in their lives, they're going to still try to hide that.
Well, how do we
Nobody
prevent
wants to.
it? How do we prevent this?
I would say just bringing more information out into the open, more
Mhm.
information. And just like you were saying earlier, don't make it seem like it's so glamorous, you know, where it's okay, it's almost okay, you know,
Mhm.
um, to have sex without protection, because you can, um, you've got something that'll almost help you cover it up, or help you not to get HIV. It's just
And the information, the thing I find interesting is the same ways you could get it before, you can still get it now. It
now.
hasn't changed. It may have mutated and the medications are better, but the same way you got it earlier in the 80s is the same way you're going to get it now.
Mhm.
Don't you think complacency um, is also a word? I use that a lot, especially with seniors, my peer group. There's a lot of
Mhm.
loneliness, a lot of neediness, a lot of women who feel like they are not fulfilled, or unless they're a part of a man.
Yes.
Medications that men can take, it messes everything up too. So, what do you think when you see people coming in? Is it also the senior community as well as not just African American, but is it senior community also?
It's senior community also. We found that out, a few years ago when I was out there doing testing and counseling for HIV. It's senior communities also.
Even then,
Mhm.
so it's only
Even
got
then, still
even then.
now.
And what would you say the reason? I gave you a few of the reasons why I feel it has, but what are some of the reasons why do you think that women are more at risk in general? What's their thing?
We're more vulnerable.
Hmm.
We're women are more vulnerable. They want somebody to take care of them. You know,
Yeah.
we feel like, and we're needy. We are needy.
That's sad, isn't it?
Yes, it is.
That is so shameful that women, especially of a certain age, because we've had some disappointments, can't stand on our own 2 feet without having a man next to us. How long have you been a widow?
Since 2017.
All right. I've been 30 years, so you're new at this, but it still hurts. So, anyway, you like the health department, the ADAP program is good.
Yes, it's good.
And tell me, what does that stand for again?
AIDS Drug Assistance Program.
And they could find that out through the health department once they get tested. If they have,
Yeah.
they can apply, right?
Yes. Hmm.
So that's really wonderful. And but you're a minister at heart. That you're a pastor in your heart.
Hmm. Yes, I am.
Yes, you are. You are a pastor in your heart, and your information is up there on the screen now, so people can contact you. I think we're very blessed, though, in Palm Beach County to have the resources we have. It's just getting to the people.
I know that I know that prep is one good thing, that people still need to um, um, know about, because if it's helping them to not get HIV, it needs to they need to use it.
And what is PrEP? Tell me about PrEP.
I I just came back on the scene. I do know that it helps people who have had unprotected sex, and they can take prep, you know, in order to not get HIV.
And
But
PEP, so PrEP and PEP,
so,
there's both of them. So they've made great progress with that, with the
mhm,
medications to take before or
yes,
afterwards. So
mhm,
they've done very well. But the stigma is still there, isn't it? That's
yes,
not
it
going
is.
to change. I think what's going to change the stigma is when some high profile person comes forward or perhaps passes away or announces that they're positive, and they take this platform out there again like it used to be. As I always
Yes,
say, act up
like
on
it used to be. Yes.
like act up on steroids to me is where we need to go. But I just am so grateful that you and I have kept in touch. The health department is blessed to have you working for them and with them. I thank Rob Scott always for connecting me with the great people and for Ricciardo
Yes,
Jackson.
he's
Isn't he great?
yes,
Yeah.
he is. He's great. Yes, I
He
really
connected me with
admire.
Ricciardo.
Yeah,
Yeah.
I've known. I remember when we used to get together um, years ago, and he's the one that told me about you back
Yeah.
then, way back then.
Yeah.
But I never got a chance to, to get with you. So
Timing is everything. And then with
yes, it
Chardo too, he
is.
connected me. He said, "This man has this webcast, this podcast. You have to be on. You have to be on his show." So I contacted him, and then when I was on his show a couple of times, I said, "We need to do this. We need to have a show called Positively Positive, where everything and all things are HIV/AIDS related."
Yes,
He said, "Let's do it."
I like the name too. Yes.
Season two. I've wanted this show for decades. Season two is official tonight with Sandra White, who's with the health department. She's a minister, a mentor, a community activist, an HIV advocate for testing. Get tested, know your status, get to the right doctor, get to the right medications, do everything you can to stay healthy because you can stay healthy. And go to Campbell Health Solutions and Ricardo Jackson, contact Campbell Health. The phone number is on the screen, 561-208-6595. And Sandra White, I'm just so grateful. I thank you so much. And I want to thank those watching, people watching and listening to this amazing program. And you can follow me on my website, brand new, beautiful website, susanmintz.com, brand new. And you can follow me on social media on Facebook, YouTube, and Instagram. And it was a great, great night, a great show, a wonderful person. I have to get my plugs in case for some reason we
Thank
did it
you.
too without getting dropped. We didn't have any issues. So thank you, Sandra, so much for
You're
being an
certainly welcome.
I will. I'll be calling you during next week to be able to talk. There's your email address again. And isn't this show
Mhm.
great? It flows. You can
Yes, it
read all.
is. It's wonderful.
Some people have the credit. I mean, just flows, and that's what it's about. Just let God do God's work.
Yes,
I'm
and that's
so
what I have to say is that if when God puts something on your heart, just do it. He did that for so many people in the Bible. They just did it. They followed him, and it works. It
yeah.
works.
If you feel it, do it.
Hmm.
And it's everything is so biblical. I just think people have stopped reading their Bibles, though, in general. And I think a lot of people are getting taught some bad things from the pulpit. Because I think there should be
Yes.
regular talks about these type of issues from the pulpit when you have a congregation gathered together regularly. That this could be a
Yes.
very important. This is not something to be talked about once every 5 years. This is something to me that should be talked about regularly.
Yes. True.
Don't you feel that way too?
Sure do.
Well,
Yes,
if
I do.
in case though we if the show is over, I just want to say thank you again, and thank you all for watching Positively Positive. Season 2 has officially begun, and we are going to be having we did over 25 interviews last year, and we're going to do more this year. But if not, the people are going to be just fascinating, and a lot of resources. People need to know where they can go,
Yeah,
and help.
we
What?
have our